One of my strongest contentions in recent years is that addressing the nocebo effect is a more important topic in healthcare than trying to address the placebo effect. Thanks to a recent study in preprint and eLife, we now have some evidence that suggests that this might be the case. So the study is called Nocebo Effects Are Stronger and More Persistent Than Placebo Effects in Healthy Individuals. So the study took 100 people and they exposed them to this heat-emitting thermode, which basically causes a little bit of pain or discomfort on the patient's skin. After establishing baseline levels of pain that they would sense from the heat-emitting device, they actually conditioned the patients to experience either a placebo effect or a nocebo effect. In order to do this, they used a TENS unit and attached an electrode to the skin, and they told the patient that when we put this device on you, it is going to either decrease your sensitivity to pain or it's going to increase your sensitivity to pain. But the device was a sham. There was no actual electricity coming from it. So during the conditioning, when they told the placebo group that they're going to experience less pain, they actually turned the heat down on the device so they would be more likely to experience less pain from that. And also for the nocebo group, when they told the patient they're going to experience more pain, they actually turned the heat up so that they would be guaranteed to feel a little bit more heat from the device. So not surprisingly, the patients in the nocebo group experienced more pain after conditioning. The patients in the placebo group experienced less pain after conditioning. And then the control group had the same level of baseline pain. What they really wanted to know is what would happen one day after the conditioning and what would happen day 8 after the conditioning. So would these effects last or would they start to fade away over time? So the placebo group did last, but the effects of the placebo started to wear away over time. But the nocebo group actually was able to maintain the higher level intensity of pain from day 1 through day 8, which was the most significant finding. These findings confirm what many scientists have observed about the placebo effect is that the placebo effect can lose its effectiveness over time. Meaning if you use a placebo for a treatment repeatedly, that the next time that you do the placebo, it's not going to be as effective as the first time. Whereas the nocebo, if someone has a nocebic belief, then that nocebic belief is going to affect the person well into the future, which is why when someone has a nocebic belief about something like a herniated disc, or about the effects of a medication, or the effects of a compound that is mostly harmless, it's going to stay with them. And every time that they think they've consumed something or interacted with something that they believe is harmful, they're going to feel the effects of it. Which means you have to work hard to mitigate the nocebo by having open communication and a strong therapeutic relationship with the patient. But also just by simply informing a patient about the possibility of a nocebo is actually something that could actually blunt some of its effectiveness too.